Our today's topic of discussion is diabetes mellitus. Diabetes is a chronic disease that occurs when the pancreas is no longer able to make insulin, or when the body cannot make good use of the insulin it produces. Insulin is a hormone made by the pancreas, that acts like a key to let glucose from the food we eat pass from the bloodstream into the cells in the body to produce energy. All carbohydrate foods are broken down into glucose in the blood. Insulin helps glucose get into the cells. Not being able to produce insulin or use it effectively leads to raised glucose levels in the blood, known as hyperglycemia. Over the long term, high glucose levels are associated with damage to the body and failure of various organs and tissues. There are three main types of diabetes: type 1, type 2 and gestational. Type 1 diabetes can develop at any age, but occurs most frequently in children and adolescents. When you have type 1 diabetes, your body produces very little or no insulin, which means that you need daily insulin injections to maintain blood glucose levels under control. Learn more. Type 2 diabetes is more common in adults and accounts for around 90% of all diabetes cases. When you have type 2 diabetes, your body does not make good use of the insulin that it produces. The cornerstone of type 2 diabetes treatment is healthy lifestyle, including increased physical activity and healthy diet. However, over time most people with type 2 diabetes will require oral drugs and/or insulin to keep their blood glucose levels under control. Learn more. Gestational diabetes (GDM) is a type of diabetes that consists of high blood glucose during pregnancy and is associated with complications to both mother and child. GDM usually disappears after pregnancy, but women affected and their children are at increased risk of developing type 2 diabetes later in life. Diabetes complications: people with diabetes have an increased risk of developing a number of serious health problems. Consistently high blood glucose levels can lead to serious diseases affecting the heart and blood vessels, eyes, kidneys, nerves and teeth. In addition, people with diabetes also have a higher risk of developing infections. In almost all high-income countries, diabetes is a leading cause of cardiovascular disease, blindness, kidney failure, and lower limb amputation. Maintaining blood glucose levels, blood pressure, and cholesterol at or close to normal can help delay or prevent diabetes complications. Therefore, people with diabetes need regular monitoring. Cardiovascular disease affects the heart and blood vessels and may cause fatal complications such as coronary artery disease, leading to heart attack and stroke. Cardiovascular disease is the most common cause of death in people with diabetes. High blood pressure, high cholesterol, high blood glucose and other risk factors contribute to increasing the risk of cardiovascular complications. Learn more about diabetes and CVD. Kidney disease: diabetic nephropathy, caused by damage to small blood vessels in the kidneys leading to the kidneys becoming less efficient or to fail altogether. Kidney disease is much more common in people with diabetes than in those without diabetes. Maintaining near normal levels of blood glucose and blood pressure can greatly reduce the risk of kidney disease. Learn more about diabetes and the kidneys. Nerve disease: diabetic neuropathy. Diabetes can cause damage to the nerves throughout the body when blood glucose and blood pressure are too high. This can lead to problems with digestion, erectile dysfunction, and many other functions. Among the most commonly affected areas are the extremities, in particular the feet. Nerve damage in these areas is called peripheral neuropathy, and can lead to pain, tingling, and loss of feeling. Loss of feeling is particularly important because it can allow injuries to go unnoticed, leading to serious infections and possible amputations. People with diabetes carry a risk of amputation that may be more than 25 times greater than that of people without diabetes. However, with comprehensive management, a large proportion of amputations related to diabetes can be prevented. Even when amputation takes place, the remaining leg and the person's life can be saved by good follow-up care from a multidisciplinary foot team. People with diabetes should regularly examine their feet. Learn more about the diabetic foot. Eye disease: diabetic retinopathy. Most people with diabetes will develop some form of eye disease, retinopathy, causing reduced vision or blindness. Consistently high levels of blood glucose, together with high blood pressure and high cholesterol, are the main causes of retinopathy. It can be managed through regular eye checks and keeping glucose and lipid levels at or close to normal. Learn more about diabetes and the eye. Pregnancy complications. Women with any type of diabetes during pregnancy risk a number of complications if they do not carefully monitor and manage their condition. To prevent possible organ damage to the fetus, women with type 1 diabetes or type 2 diabetes should achieve target glucose levels before conception. All women with diabetes during pregnancy, type 1, type 2 or gestational should strive for target blood glucose levels throughout to minimize complications. High blood glucose during pregnancy can lead to the fetus putting on excess weight. This can lead to problems in delivery, trauma to the child and mother, and a sudden drop in blood glucose for the child after birth. Children who are exposed for a long time to high blood glucose in the womb are at higher risk of developing diabetes in the future. Learn more about diabetes in pregnancy. Oral complications. People with diabetes have an increased risk of inflammation of the gums, periodontitis, if blood glucose is not properly managed. Periodontitis is a major cause of tooth loss and is associated with an increased risk of cardiovascular disease, CVD. Regular oral checkups should be established to ensure early diagnosis, particularly among people with previously undiagnosed diabetes, and prompt management of any oral complications in people with diabetes. Annual visits are recommended for symptoms of gum disease such as bleeding when brushing teeth or swollen gums. Diabetes prevention. At present, type 1 diabetes cannot be prevented. The environmental triggers that are thought to generate the process that results in the destruction of the body's insulin-producing cells are still under investigation. While there are a number of factors that influence the development of type 2 diabetes, it is evident that the most influential are lifestyle behaviors commonly associated with urbanization. These include consumption of unhealthy foods and inactive lifestyles with sedentary behavior. Studies from different parts of the world have established that lifestyle modification with physical activity and/or healthy diet can delay or prevent the onset of type 2 diabetes. Modern lifestyles are characterized by physical inactivity and long sedentary periods. Community-based interventions can reach individuals and families through campaigns, education, social marketing, and encourage physical activity both inside and outside school and the workplace. IDF recommends physical activity at least between 3 to 5 days a week, for a minimum of 30 to 45 minutes. Taking a life course perspective is essential for preventing type 2 diabetes and its complications. Early in life, when eating and physical activity habits are established and when the long-term regulation of energy balance may be programmed, there is an especially critical window to prevent the development of overweight and reduce the risk of type 2 diabetes. Healthy lifestyles can improve health outcomes at later stages of life as well. Population-based interventions and policies allow healthy choices through policies in trade, agriculture, transport and urban planning to become more accessible and easy. Healthy choices can be promoted in specific settings, school, workplace and home, and contribute to better health for everyone. They include exercising regularly and eating wisely, which will help to maintain normal levels of blood glucose, blood pressure and lipids. Type 2 diabetes prevention studies. There is overwhelming evidence from studies in the USA, Finland, China, India and Japan that lifestyle changes, achieving a healthy body weight and moderate physical activity can help prevent the development of type 2 diabetes in those at high risk. The Da-Ching study examined the effect of a 6-year diet and exercise intervention in Chinese individuals with impaired glucose tolerance (IGT) and an average age of 45. The diet intervention alone was associated with a 31% reduction in the risk of developing type 2 diabetes, while the exercise intervention alone showed a 46% reduction. The combined diet and exercise group had a similar 42% reduction in the risk of developing type 2 diabetes during a 6-year follow-up period. The Finnish Diabetes Prevention Study (DPS) was the first randomized controlled trial to specifically examine the effect of a lifestyle intervention in preventing type 2 diabetes. This study randomly assigned 522 overweight or obese individuals with IGT to either a lifestyle intervention or a control group and followed them for approximately 3 years. The lifestyle intervention provided individualized counseling focused on achieving and maintaining healthy body weight, reducing fat intake, increasing fiber intake and increasing physical activity. After 2 years, the incidence of type 2 diabetes in the intervention group was less than half that observed within the control group. The Diabetes Prevention Program (DPP) was conducted in 3,234 U.S. adults with IGT. Unlike most previous studies, the cohort was diverse and included a large proportion of women, 68%, and ethnic minorities, 45%, and compared lifestyle intervention versus drug intervention, metformin, and a placebo control group over 2.8 years. The DPP reported that both lifestyle intervention and metformin had positive effects on the prevention of type 2 diabetes and restoring normal glucose tolerance. The lifestyle intervention was more effective in preventing type 2 diabetes, particularly in older adults. The Indian Diabetes Prevention Program (IDPP) was a prospective community-based study that examined whether the progression to type 2 diabetes could be influenced by interventions in native Asian Indians with IGT who were younger, leaner and more insulin-resistant than in multi-ethnic American, Finnish and Chinese populations. Results showed that progression of IGT to type 2 diabetes is high in native Asian Indians. Both lifestyle modification and metformin significantly reduced the incidence of type 2 diabetes in Asian Indians with IGT. IDF recommendations for a healthy diet for the general population: choosing water, coffee or tea instead of fruit juice, soda, or other sugar-sweetened beverages. Eating at least 3 servings of vegetable every day, including green leafy vegetables. Eating up to 3 servings of fresh fruit every day. Choosing nuts, a piece of fresh fruit, or unsweetened yogurt for a snack. Limiting alcohol intake to a maximum of 2 standard drinks per day. Choosing lean cuts of white meat, poultry or seafood instead of red or processed meat. Choosing peanut butter instead of chocolate spread or jam. Choosing whole grain bread, rice, or pasta instead of white bread, rice, or pasta. Choosing unsaturated fats, olive oil, canola oil, corn oil, or sunflower oil, instead of saturated fats, butter, ghee, animal fat, coconut oil or palm oil. A particular threat in terms of the associated risk of developing type 2 diabetes is the consumption of high-sugar foods, particularly sugar-sweetened beverages. In 2014, the World Health Organization (WHO) issued new recommendations to limit sugar intake. IDF fully supports these recommendations and in response published the IDF Framework for Action on Sugar. Diabetes Facts and Figures. The IDF Diabetes Atlas 9th edition 2019 provides the latest figures, information and projections on diabetes worldwide. In 2019, approximately 463 million adults 20 to 79 years were living with diabetes. By 2045 this will rise to 700 million. The proportion of people with type 2 diabetes is increasing in most countries. 79% of adults with diabetes were living in low and middle income countries. The greatest number of people with diabetes were between 40 and 59 years of age. 1 in 232 million people with diabetes were undiagnosed. Diabetes caused 4.2 million deaths. Diabetes caused at least USD $760 billion in health expenditure in 2019 to 10% of total spending on adults. More than 1.1 million children and adolescents are living with type 1 diabetes. More than 20 million live births, 1 in 6 births, are affected by diabetes during pregnancy. 374 million people are at increased risk of developing type 2 diabetes.